A stroke occurs when there is a sudden disruption of blood flow to the brain, leading to the death of brain cells. This can result in lasting neurological deficits depending on the area of the brain affected. Types of stroke. First, we have ischemic stroke. This is caused by a blockage in a blood vessel supplying blood to the brain. This can be further divided into thrombotic stroke, where a blood clot, or thrombus, forms in an artery supplying blood to the brain. And then there's embolic stroke, where a clot or debris forms away from the brain, often in the heart, and travels through the bloodstream to lodge in narrower brain arteries. Next, we have hemorrhagic stroke. This occurs when a blood vessel in the brain bursts, leading to bleeding in or around the brain. This can be due to intracerebral hemorrhage, which is bleeding within the brain itself, or subarachnoid hemorrhage, which is bleeding in the space between the brain and the tissues covering it, often caused by an aneurysm. Diagnosis involves a few steps. First, there's clinical assessment, which includes evaluating symptoms like sudden weakness, confusion, trouble speaking, or difficulty walking. Then we have imaging tests. A CT scan quickly identifies hemorrhagic strokes, while an MRI provides detailed images of brain tissue and can detect ischemic strokes. Blood tests are also important to check for underlying conditions that could contribute to stroke. Finally, angiography involves imaging of blood vessels to identify blockages or abnormalities. Management of stroke involves different approaches depending on whether it is ischemic or hemorrhagic. For ischemic stroke, medications such as tissue plasminogen activator or TPA can be administered to dissolve blood clots, but it must be given within a specific time window. Another option is mechanical thrombectomy, a procedure to physically remove the clot. For hemorrhagic stroke, surgery may be necessary to repair the blood vessel or relieve pressure on the brain from blood accumulation. Additionally, medications can be used to control blood pressure and prevent seizures. The outcome of a stroke depends on various factors, including the type of stroke, the area of the brain affected, the speed of treatment, and overall health. Many individuals can recover significantly, but some may experience long-term disabilities, affecting their quality of life. Prevention of stroke can be approached in several ways. First, lifestyle modifications are crucial. Eating a healthy diet rich in fruits, vegetables, and whole grains, while low in saturated fats and sodium, is important. Regular exercise helps maintain a healthy weight and reduces blood pressure. Quitting smoking and limiting alcohol consumption can also significantly reduce the risk of stroke. Next, medical management plays a vital role. Regular health checkups to monitor blood pressure, cholesterol levels, and manage diabetes are essential. For individuals at high risk of ischemic strokes, medications such as anticoagulants or antiplatelet drugs may be recommended. Lastly, awareness of stroke symptoms, like those in the FAST acronym, face drooping, arm weakness, speech difficulties, and time to call emergency services, can lead to quicker treatment and better outcomes.